to get through all of this to reveal the underlying structures. So already I can kind of see this string-like structure. Do you see that? That's the facial vein. Facial vein. Literally, this is the third time I've done this. I'm tired. Facial nerve, okay? My parotid salivary duct, or my salivary duct, is actually right here. So you're looking for linear structures. As you can see on the board, I put dissect the nerves and ducts and glands first. Those are the most delicate. And they all lie near that masseter muscle. So page 153, this diagram here is going to be your key to getting that part of the dissection done. Okay? So this is the part that I didn't dissect. Let me show you what it looks like after you reveal everything. You see I've removed that muscle and the fascia. You see that here's my facial nerve, which you can look on that page is the one on the top. And do you see it branches into a couple different sections? You can see my little branches here. Facial nerve. So what I've done is I've dissected it away and I've used a probe or the tweezers and I've lifted it off the top of the masseter so it's easy to see. Okay? You see this other large linear structure here? What's the green one underneath? What's it called?
No.
The parotid duct, right? It's not on your list. For some reason I forgot to add it, so write it down. Parotid duct. I'm sure Dr. Alderson has mentioned one of the keys to studying for this information is that most of these structures are labeled or named based on where they're located or what they're doing or where they're going. Okay, so parotid duct goes from the parotid salivary gland, which you can see on your page is that green structure under the ear. Okay, you have fascia over there initially, so you're going to have to dig away from that and you will see this parotid salivary gland. And you see the duct that's attached to it? It goes all the way to the mouth. So saliva is then distributed into the mouth from that parotid salivary gland. Okay? There are also some other little nerves down here, but we don't have to know them. But it's good because it helps you reference where you're at, because those nerves are also on your sheet here. We just don't need to know them. Okay? So I want you to start here. To gently dissect and find the facial nerve and the parotid duct. Okay? From there, I want you to locate the rest of the glands that are in the neck area. So the parotid is right under the ear. Do you notice in the textbook it shows the parotid and the mandibular gland is green and it has little lines running through it? It's because it's a lobular structure. It's not smooth. And you can kind of tell this is kind of a chunky looking structure, and this one as well. Do you notice that the blue, though, the mandibular lymph nodes, those are smooth, okay? Parotid, salivary gland, parotid duct, facial nerve. What's this big, thick muscle? Masseter muscle, okay? Masseter muscle. This gland, which is underneath the vessel coming off of the jugular vein, so it's buried in your cat, so you're going to have to dig it out, is the mandibular salivary gland. And where's the mandible? What is it? The lower jaw, right? The lower jaw arcade. So that should tell you that here's my lower jaw, comes up over here, it's right underneath it. So that should give you direction on where to locate this structure. So parotid salivary gland, mandibular salivary gland. Up along this linguofacial vein is the mandibular lymph nodes, and they pair on each side of the vessel. You see that? Okay. So once again, the glands: parotid salivary gland, mandibular salivary gland, mandibular lymph nodes. Okay? I want you to start with those structures. Those are the ones you need to find first. Let's start from the beginning of the sheet. First thing is philtrum. Does anyone know what that is? Right. So on us, it's a piece of skin, right?